I am a respiratory therapist for Providence Healthcare at Sacred Heart Medical Center. Respiratory therapy, we are airway specialists and we really specialize in the cardiopulmonary system, so the heart and the lungs. We go into the healthcare setting focusing on people who are having a hard time breathing, people who are having a hard time with their lungs. Maybe it was asthma, emphysema, COPD, something of that nature. They aren't able to breathe properly. So a respiratory therapist is going to come in and maintain that airway, deliver medications to help them breathe, put them on life support. So when you hear of a patient who is on a ventilator in the ICU on life support, is going to be a respiratory therapist who is going to be at the bedside maintaining that airway, placing that airway, running that ventilator, etc. So we are really there to help people who are having any sort of, again, those heart and lung issues, supporting them through that process. Respiratory therapists can work in most settings, but the vast majority of us are found in the acute care settings, so the hospital settings. So whether that's adult ICU, cardiac ICU, it could be neonatal ICU, pediatric ICU, but we also do general floor care as well. Associates is the minimum for entry to practice. However, a lot of the programs are transitioning to bachelor's degrees for entry to practice. There is a very large demand for respiratory therapy. It's pretty amazing to know that things that we do are changing people's lives. And to go home at the end of the day knowing that you did everything you could to help a person is extremely fulfilling.